Hi everyone, and a very warm welcome to our webinar. And by warm, I'm not just talking about the weather outside. I don't hope it's nice where you are. Currently it's scorching. I have got my window open, so hopefully there won't be too much background noise for you. And if I hear any cars going past, I'll try and speak a bit louder. So today we're going to be talking about the careers in the health service, specifically the allied health professions, a family of practitioners in the NHS and also privately that are working to make sure patients are able to live their absolute optimum life. My name is George and I'm an outreach officer based up at the University of Liverpool, working on this campaign called I See the Difference. And joining with me today, I've got my colleague Rachel. Rachel, if you want to introduce yourself.
Hi, my name is Rachel. I'm one of the outreach officers. I work for the College of Podiatry, so I'm moderating today. And I'll be handling your questions. So I think we're taking some questions at the end, and I'll try and answer some tailored questions as we go along.
Brilliant, thank you very much, Rachel. So before we start, something that I just want to say is what we want to do is try and make these as best as we possibly can for for everyone who's watching. So at the end of this, about an hour after the webinar finishes, we have a evaluation form that will be coming out to you. If you don't mind taking a few minutes just to fill this out, we'd really appreciate it. Your feedback really does help us try to improve on these to make sure the content that we're offering is right for the correct audience and you're getting everything out of it that you wanted to. Okay, so if we make a start now, so a few objectives of this webinar. So we'll highlight these key 15 roles in the NHS and categorize these careers according to kind of their place of work or their focus, and also match some of these jobs to some of the soft skills required for the role. We're assuming that you guys are career advisors or advisors offering information to students. If you aren't, feel free to stay onto the webinar. It's will still give you a lot of information. So I've said the term allied health professional a lot, and I appreciate some of you may not know what all of these are. Probably in your roles or your areas, you have got probably a slightly better understanding of what some of these professions are than some students. But these are the 15 different roles. Very common ones that a lot of people know about are paramedics. Obviously, they're on the streets, they're on TV, they're really hard to miss. If you don't really know what a paramedic is, that's quite a big gap in your knowledge. Another common one is also physiotherapists as well. There are some that, unless you have required their services, they're quite hidden away from you in the NHS and in the health service. And these are some of the ones that we're going to be focusing on in a bit more detail throughout this presentation. So just as a kind of initial statement, these allied health professionals are practitioners that look after children and adults, trying to either rehabilitate them or help them to adapt to life with maybe an ongoing condition or health issue. They often manage their own caseload, so often the patients that they're seeing are their patients. They're not really following, for example, the doctor's kind of orders or treatment plan, which is a lot more common in nursing, especially in the early years of nursing. So there are a number of reasons why students should become an allied health professional. Firstly is the employability rates. It is incredibly, these are all incredibly employable professions, and if students are looking for professional degrees, which kind of guarantees them a job at the end of them, these are fantastic kind of degree to go for. 90% of the students that graduate from these courses end up working within their respective fields within 6 months of graduating. So the other 10% doesn't mean that they're jobless. What they will generally have done is taken their skills and transferred them to another area, because what these professions teach you is fantastic communication skills, ability to interact with people and patients, and good kind of analytical skills, which makes them really desirable for other areas as well. With these professions, you can choose to work in the NHS, and this is the kind of primary route that students will go into, especially after they've graduated. And there's also the option as well for private practice as well with a number of these. Obviously, when you have private practice, it does give you a little bit more control over your working life, especially if you're setting up private practice for yourself, which obviously gives a bit of kind of entrepreneurialship to your life. But it also means that you get a bit more control over your salary as well, because you're choosing what you're charging your patients. The working hours that you generally work are pretty good. They're the core kind of working hours, so Monday to Friday, 9 to 5. And what this generally means is that it can be a lot easier to kind of fit around your work or fit around your life and have that good work-life balance. That being said, there are obviously some professions where you do have to have a bit more flexible working pattern or potentially work shifts. For example, paramedics, again, they are part of a 24-hour service of the NHS, and unfortunately you can't just have a night off, because one or two patients will still have emergencies at all hours of the day and night. All these university degrees that offer these courses and the qualifications that you get are really highly regulated, and because of that, these qualifications are actually recognised all over the world. So if you wanted to do a degree at one of the UK universities, you'd be able to transfer those skills to another country. So for the world, that is something you're perfectly able to deal with you. As mentioned, with many of these professions, the patients that you are seeing, they are your patients. You're the one that initially sees them, creates a diagnosis for what you think is wrong with them, and creates a treatment plan, through that treatment plan with the patient. So it does give you a lot more kind of control and autonomy over your working life. There's loads of chances to specialise. Every profession will have its own area of specialism, and those are areas to kind of diversify your roles. This is obviously good because nobody ever really wants to do the same thing day after day, time after time. It can get really repetitive and also really boring. So it's always good to have that variety. It is the spice of life. Another great thing is obviously the entry requirements. A lot of students obviously aspire to be doctors. Unfortunately, with it being such a competitive area, it can be quite difficult for every student to achieve a place in medical school. The entry requirements for these professions are much lower than the likes of medicine, which are obviously 3 A's. These can range from 2 A's and a B all the way down to 3 C's, so it makes them a lot more realistic. With these professions, generally the entry requirements will change depending on popularity of the course. So the slightly more popular courses will be the higher grades, and the more popular universities, or the universities that are higher in the rankings, will usually set their entry requirements a little bit higher as well to reflect that. And finally, there's also the return of the NHS grant or bursary, which was advertised for the nurses, also applicable for a number of these allied health professions, and I'll talk about that more in detail towards the end of this presentation. And finally, the last thing to talk about is the NHS salary. So this is just the salary for the NHS practitioners and doesn't reflect the salaries that can be achieved through private practice. But with the majority of these different professions, as soon as you graduate, you're eligible to start working on a band 5 salary within the NHS. So this is about 24,000. So already as a graduate salary, it is really, really quite healthy. And if the practitioner just wanted to do the same thing day after day, not really advance their skills or do more, within 7 years, they'll be on that upper limit of about 30,000, which again is a very good salary to have. But most people do want to advance and do more and gain more skills and have more responsibility, and that's great. Band 6 salary is generally known as the more advanced or specialist practitioners. So once graduates have got more skills and kind of expertise under their belt, they're able to start applying for these jobs at slightly higher bandings. So as I said, band 6 are more the advanced practitioners, and that's 30,500. You've then got band 7s, which are kind of more the team leader role in the NHS. So you start getting into a bit of kind of team management within your department, and that extra responsibility is reflected by the even higher salary of 37,500. And then you've got your band 8s, which are kind of your mid or senior level management positions in departments or in the hospital. They start at 8A, which is 44,500, and can go all the way up to 8D, which is more the kind of head practitioner of head of a department of quite a large kind of different practitioners. So for example, Moorfields Eye Hospital is a very large eye hospital, so their department practitioners will likely be AHPs. You've then got band 9s, which I will admit are fewer and further between than some of the lower bands, and these are probably more for the either consultants with a large amount of experience or practitioners that have chosen to go into the more surgical routes if they're available. For example, with podiatry, you can choose to go into podiatric surgery. So that is training and qualifying to perform surgery of the feet. Unfortunately, you're not allowed to go any higher. But what that does mean is you're able to have that even higher salary of about 89,500 starting, which is, that is the dream. So what we've done here is try to break these professions down into different categories to kind of demonstrate the different areas. So, for example, some which are focusing on trying to help improve patients' mobility and making sure that they're trying to keep their independence a bit more. Focusing on roles that are more acute care, so patients that might have a short-term treatment which they'll hopefully recover from. Or you might have some which focus on speech or more kind of creative therapies as well. So if we start with the professions that help with mobility and independence, the first one that you might talk to is a dietitian. So dietitians are absolute experts of nutrition and diet, and they might focus on two kind of main areas. So looking at patients who might have mental health conditions, for example, patients that might have eating disorders, working with them to try and get control over the diet in a much healthier way, so they're able to then hopefully try and get over some of the conditions they might have been having, or at least improve their health. From a more physiological point, it could be working with patients who might be over or underweight, trying to help tailor the food and their diets, creating meal plans to make sure they're able to get their correct nutrition, because for some people, kind of being able to know actually what is the right food to eat can actually be a challenge for them. And once they kind of have that understanding, they're able to then start kind of progressing on their own. It could also be looking at patients who might have diabetes and need advice on what food they can and cannot eat, or dealing with patients that might have had a stroke and no longer able to get the correct nutrition through a solid diet. So dietitians would prescribe nutrient shakes to make sure they're able to get that correct nutrition. The difference between a dietitian and a nutritionist, I know a lot of students often ask, is a dietitian is someone who has taken a course in Dietetics, and this is a registered course, and upon completion, students can then register with the governing body, the Healthcare and Practitioners Council, which basically allows them to be a registered body or a registered practitioner, and they will then be able to call themselves a dietitian. Anyone can call themselves a nutritionist, dietitian, or someone who has done a course in dietetics but chosen not to register can call themselves a nutritionist. Unfortunately, only people who have completed that course and chosen to register can call themselves a dietitian. Next up, we have occupational therapists. So occupational therapists is all about trying to make sure that patients are able to do the activities that they enjoy and they love. The occupation in the term occupational therapy isn't just talking about patients' jobs. An occupation is a meaningful activity that kind of brings kind of motivation or a kind of feeling of self to a patient. So often when patients might have had an injury or had an illness, they might lose the ability to do these occupations that kind of give them independence and joy and happiness. And occupational therapists are all about trying to improve the patient's life through either changing the way that patients might think through more mental health focus, or add adaptations to patients' lives so they're able to carry out and perform the activities they were able to do before they had their injury or accident. An example of this could be dealing with a patient who might have agoraphobia, so a fear of open spaces, and working with them to try and do more and more and more, so they can start doing more simple tasks they might not be able to do, such as, for example, going to the corner shop to buy themselves a pint of milk, which for you and me sounds like absolutely not a problem at all, easy, but for them, you might as well ask them to climb a mountain. It seems that impossible for them. From a more physiological point, it could be from a patient who's had an accident and lost the ability to get themselves on or off the toilet by themselves, and then requires the aid of someone else, which can have a huge impact on their independence as well as their dignity. So trying to apply aids or devices to help them be able to achieve that themselves is part of a role of an occupational therapist. They can also work in patients' homes, in workplaces as well as hospitals. Generally, occupational therapists like to fan themselves out into lots of different routes and sectors. Orthoptists, I will talk about a bit more later on, because this is one of those key shortage areas, as well as prosthetics and orthotics and podiatry. So the next one that I'll talk about is osteopaths, which is a study of osteopathy. And with this profession, it's all about trying to relieve patients' pain through either adjustments and manipulations to the human body or anatomy, or through massage, and often can be quite a holistic approach. Sorry, it's very hot, words are failing me. And I don't know if you've seen any videos on Facebook or social media of patients going and having their backs cracked or necks cracked. I find them very satisfying videos. I know some people can find them a bit horrible, but in many cases these are being performed by osteopaths, and these adjustments and manipulations will hopefully be able to relieve pressure or pains to patients and allows them to recover. With this profession, they're not just looking at, you've got a pain in your elbow, we'll focus straight on the elbow. They'll be looking at the patient's history to try and potentially work out what maybe has caused the pain in the elbow, because that could be the root cause, which is then affecting the other area of the body. So it's a little bit kind of like detective work. The last one that I'm going to talk about on this slide is physiotherapy, and this is a profession which is all trying to rehabilitate patients, they get back to the level of fitness they were potentially before they had an injury, or at least as best as they possibly can do. So as an example, my uncle recently fell over and he broke his arm in 3 places. He's now had his cast off and he's now seeing a physiotherapist. He was initially seeing the physiotherapist actually in person. However, as a response to the COVID situation, he's now having these appointments over Zoom, which in itself is a problem for him. He's not tech savvy, but these appointments are teaching him how to strengthen his arm and his wrist, so he's able to get full movement back and do everyday activities which he enjoys, such as something as simple as making himself a cup of tea. He's a man of simple pleasures. This can often be considered quite a sporty profession, and a number of practitioners choose to go into the kind of sports and dealing with athletes. And if you think of the likes of Mo Farah and Nhs Salary and any other Mo that does sports, they will have a team of physiotherapists behind them to making sure they're able to perform at their absolute optimum, because their ability to win is their ability to be the best. So they need to make sure they're able to do this and maintain their level of fitness and body health. So then we've got some which are all about trying to use different techniques to try and help patients express themselves, and use largely a number of different types of therapy techniques. So we have art, music and drama therapists. These are actually all postgraduate degrees, so you would do an undergraduate degree in either art, drama or music, and then you would have to do a postgraduate degree in either art, drama or music therapy to learn how to use these skills as a form of treatment for patients. And I find that some patients, especially some that aren't necessarily the most kind of in touch with their emotions, express how they're feeling kind of verbally, these can be really, really good ways of helping them express themselves through different medium. So an art therapist would be getting a patient to create a piece of artwork, or maybe a drawing, a sculpture, and try and get them to work through potentially how this piece of artwork might be reflective of their emotions and some of their feelings, and potentially reflect some of the inner turmoil that they might be experiencing. And hopefully this will then allow them to start overcoming some of these issues. Music in itself is very therapeutic, and can be used as a fantastic tool to try and help patients recover. It can also be used to help patients with writing song lyrics, maybe express how they're feeling, and hopefully this will be able to help them. With drama therapy, it's all about body movement and role play and simulation to try and help maybe reenact some of the issues they might have had previously. Speech and language therapy kind of have 2 main focuses. So you've got the more kind of mental health or developmental focus. So this could be interacting with young children who aren't necessarily communicating at the correct level or at the same level as their peers, and working with them to try and get that communication level back up to the level so they're not going to be disadvantaged later in life. From a more biological perspective, it could be working with patients who have had a stroke and have lost their ability to speak, or they've had reduced communication skills, working with them to try and get those skills back up. Alternatively, it could be with a patient who has got a completely functional speech, but due to a degenerative condition over time, that they might start losing their ability to speak and communicate. So getting adaptations in place already, so when it comes to the time where they're unable to communicate verbally, they'll still have communication techniques in place. For example, the condition motor neuron disease, which Stephen Hawking had, they would be able to fit a device which would enable a computerized voice to talk for them. And finally, we've got the allied health professionals, which use active short-term to try and help people. Firstly, you have diagnostic radiographers. So these are generally the practitioners that you will see if you've ever broken a bone. So when my uncle went and broke his arm, he was seen by a diagnostic radiographer who then took an X-ray of his arm. Often people just think that all the diagnostic radiographers do is take a photo and send it through to the doctors, and that is not at all the case. What they'll do is make sure the patient's correctly positioned, making sure that their images as best as possible to see any potential injury that the patient sustained. Once the image has been taken, they'll observe it, investigate, and then annotate any areas worth noting, and then pass that through to the doctor, who will then confirm with all the other pieces of all the other tests that he ordered or she's ordered, to confirm whether or an overall picture of the patient's health. They're all about using kind of X-rays and high-tech piece of equipment as a form of diagnosis for patients. Next up is paramedics. I won't go into this too much detail about this one, just because I feel like most people have a very strong grasp of paramedics. Obviously, they're on the front line of the emergency services, and they're the first responders prepared for almost any situation. With this profession, students and practitioners do need to have quite a high level of resilience, because they do have to be prepared for any situation, and sometimes it can be quite unpleasant. So they do have to have that high level of resilience to prepare themselves for everything that might come at them. Sorry, one sec. So next up is the operating department practitioners, often shortened to ODPs, and these are almost, I like to liken them to a conductor of a surgical orchestra. So they are almost like the runners between all the different practitioners that work in a surgical theatre, kind of linking up all the different practitioners and kind of coordinating them. They'll work throughout different types of patient treatment, so they'll be there for the preoperative care, they'll be there during the surgery, and they'll be there post-surgery as well, making sure that the patient's okay in their recovery. What you often find is surgery, operating department practitioners generally take two roles, either assisting with the anaesthetist who's putting the patient to sleep, or they'll be helping more on scrub side, assisting the surgeon with the actual surgery. So that's, like in many cases, helping count the tools in, and very, very importantly, counting the tools that come back out. It's really important that what goes in must come out, otherwise patients will leave the surgery a little bit more magnetic than when they first went in. Often you'll find that operating department practitioners are absolute experts of the airway and emergency situation. When patients are being brought in by the paramedics, what they'll often call for is an ODP to come to the situation and support the patient's airway, to ensure the ventilation is possible until they can get to a more secure ventilation facility on a ward. And finally, we have therapeutic radiography, which I'll talk about a bit more in a second, because this is another example of one of those key shortage areas in the NHS. So there are other ways that we can categorize these further. So it could be looking at whether patients are with specific groups, or if they want to work more by themselves. There's also different areas where patient or practitioners are more, oh, sorry, voice is going there. There are some areas which are more kind of scientific, some which are a bit more sporty, some which are a bit more artistic. And attached to this webinar, you should be able to find our career advisor pack. And in here, you should be able to see a breakdown of these different roles according to that different criteria as well. So these are the 4 kind of key shortage areas in the NHS, which this project is trying to extra promote, just because these are the ones that, as I've previously mentioned, unless you've required their services, they are quite hidden and students don't often know that they exist. So we're here just to try and give these professions just that little extra boost. So I'll start with orthoptics. So orthoptics, people often ask what it is. It is not an optician. Both orthoptists and opticians look at the eyes, but an optician is more based on the high street, looking at whether patients need glasses or a prescription in their lenses to kind of improve their sight. If there's an issue with eye movement or problems with the connection between the eye and the brain, they'll often refer them through to an orthoptist or an ophthalmologist, who is a doctor who specializes in eyes, more so for the surgery of surgical treatment of eyes. An orthoptist is more based in a hospital. Opticians can also be based in hospitals, but not as in higher numbers. And what orthoptists do is use visual assessments to diagnose and treat problems affecting the eye and how the brain connects to the eye. They'll look at a number of different conditions, and the main condition which they'll see is double vision. This is really their kind of bread and butter condition, and this can be caused by a wide number of things, from anything as common as high blood pressure to anything as sinister as a brain tumor. So it's really, really important that if any patient has got double vision, it's checked out really quickly, and not just because of how severe it can be, but also because of how unpleasant it can be. It can make people feel very, very dizzy and really sick, and also it would have a bit of an effect on their independence, as they wouldn't be able to drive or do many activities for themselves which they normally would want to, because it just wouldn't be safe. They also see patients who might have turns in their eyes. So this is often caused by a muscle imbalance around the eye. So often it's called a squint, you may have heard. And what can happen with a squint is when the eye turns, it can often cause reduced vision in one of the eyes, which is called a lazy eye. So this can basically be formed by reduced connection between the eye and the brain. The nerve cells just aren't as developed as they should, and the signal from the brain to the eye just isn't getting through as strongly as it has to create a kind of good level of vision. So the way that you can treat this is firstly to look at the turn in the eye and look at the treatment for that. And the ways that you can do this is really simply through exercises for the eyes, trying to strengthen the muscles around the eyes. And you can also use something which is more of a temporary fix called a prism. So this is a piece of plastic or glass which can be put into some glasses, and it causes light to bend and basically tricks your brain into thinking that both of your eyes are facing forward. There are some slightly more invasive treatments which can be used. Firstly is surgery. So an ophthalmologist, so the doctor who specialises in eyes, very gorily can detach the muscles from the eye, or at least the weaker or the stronger muscle, and then reattach it in a slightly different place. And then an orthoptist will come in and do a visual assessment to make sure that the eyes are correctly aligned. And then if they are, the surgeon will put a more secure suture in place, and hopefully that will fix the problem with the imbalance of the muscles. There's another technique which orthoptists can perform themselves, which is actually Botox. So Botox works by paralyzing muscles, which is how it's able to get rid of foreheads and people's wrinkles, or get rid of wrinkles in people's foreheads. Wow, I'm getting all my words mixed up today. And what will happen is you can inject this Botox into the muscle of the eye, which is slightly stronger, and this will then weaken that muscle in the eye, importantly making both muscles on either side of the eye equally weak, and allows the eyes to face forward in the correct direction. It's actually really cool. As they inject this, you can actually see the eye start to turn around and face forward. It is very, very cool. But I am willing to admit it is a bit unpleasant sounding. So lazy eyes can also be treated through a patch over your strong eye. So often with lazy eyes, you'll have one eye which is stronger and one eye which is weak. So the stronger eye is your dominant one, and it's what your brain's using for vision. And essentially, your brain just thinks, well, I can still see. I don't need to do anything about this weaker eye. It's fine. But when you put the eye patch over the strong eye, your brain goes, ah, I cannot see. So it then start signaling development of the nerve cells that connect the eye to the brain, and hopefully this will then improve vision and allow both eyes to work together. This unfortunately can only be done before the age of 8 years old, so often you'll find orthoptists in communities as well screening primary school children to make sure there are no problems with their eyes. Next up is podiatry. And with podiatry, what you're doing is looking at largely patients' lower limbs and feet, making sure that they're able to get around without pain as best as possible. They might be looking at treating conditions such as ingrown toenails or calluses, so a build-up of dead skin, which can be very, very painful, or treating infections such as verrucas or warts, and this can be really easily treated via liquid nitrogen, just spraying onto the infection, and hopefully that will clear it up. But also look at some maybe more long-term or chronic conditions such as arthritis or diabetes. And diabetes care is particularly quite a large area of podiatry, and the reason for this is it can have really, really unpleasant complications if left untreated, because the further you get away from your core, the more poorer your circulation is, and as a result what can happen is less blood will get to your lower limbs and your feet, which means if you get an infection you have less of an immune response to your lower legs and your feet, which means the infection can get a bit more out of control, and if left untreated that can then result in amputation of the limb, so either amputation of the foot or their lower leg, which is honestly probably the last thing any practitioner would want for their patient, and it's definitely the last thing any patient would want. It would have a huge impact on their independence and a giant knock-on effect of their mental health as well. So it's really, really important that you have these professionals here working with doctors and nurses and other allied health professionals, so it doesn't get to that stage where it requires such extreme measures. I like to think of the human body as kind of like a house, even if it's a slightly weird moving house. If you don't have good foundations, you're going to start having problems higher up. So your feet are your foundations, and I'm sure many of you will have had experiences in your life where you've twisted your ankle or had a pain in your foot, which has caused you to walk a little bit differently. And by the end of the day, after walking, you just think, God, my hip hurts. And that's an example of how problems slow down if left untreated, and then start working its way up and start affecting other parts of your body. So it's really important to take care of your foundations. Next up we have Prosthetics and Orthotics. So this is actually one degree at university, so it's a degree in Prosthetics and Orthotics, which gives you the skills and training to go on to do two roles, to be a prosthetist, who is a practitioner who creates an artificial limb, kind of like this chap's being fitted onto his leg, or an orthotist who creates artificial structures which acts almost like a splint or a scaffold, or a brace to kind of hold patients' kind of limbs in a kind of more secure position. These devices are very rarely just taken off the shelf. They're often made to fit, and they're very unique to each patient. And with this profession, it's very much more of a bioengineering or biomechanics profession, because you're not so much looking at the actual patient's anatomy. What you're looking at is how can this device best fit and adapt to the patient's anatomy. The bonds that you form with this profession, with practitioner and patient, can often be quite strong, because especially with patients who have required their services from quite a young age, as they develop and as they grow, they will require new devices to be made to help fit into their life. Obviously, if you're a child, you're going to need a new device by the time you're a teenager, and by the time you've gone from a teenager to adult, you're going to need a new device as well, and probably multiple devices to bridge those gaps. So this is prosthetics and orthotics. Next up, we have therapeutic radiography. So I mentioned earlier on diagnostic radiography, which is all about using x-rays and high-tech pieces of equipment as a form of imaging and diagnosis. Therapeutic radiography uses these high-tech pieces of equipment and radiation as a form of treatment. That's where therapeutic comes in. and using really high-tech piece of equipment like you've got on the screen here. So this is the LINAC machine. What it does is really precisely and accurately delivers a precise amount of dose of radiation to cancer cells or tumor cells. So the patients that these practitioners generally see are largely cancer patients. However, they will also treat other patients as well. And what this does is it introduces radiation into these cells, because the way cancer cells are able to grow so much and get out of hand and result in a tumor is there'll be a mutation which isn't picked up in the DNA of a healthy cell, which has an effect on the regulation of this cell growth, where instead of a healthy cell going grow, 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 stop, what will happen is a cancer cell will lose its regulation and it will just go grow, 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 grow until it gets out of control and forms this mass. But what it does is, what then happens is it loses its ability to repair its DNA. And what this treatment does is uses these X-rays to put in loads of new mutations into the cells, where the cancer cells then even lose their ability to grow, and it just halts their replication. And this allows the immune system to come in and hopefully mop up these cancer cells, or allows the patient to have some surgery to then have this cancer removed from the body. And in many cases, there are a number of cancers where this treatment can be used as a cure and can be incredibly rewarding. However, there are some conditions where this can't be used as a cure. What this can be used as is a form of kind of allowing for more time for the patient to be with their family. It's not always the kind of happiest of professions, and it does require some resilience, but this is a profession where it can be so immensely rewarding because you can actually save patients' lives. With this profession, I don't think I've met a therapeutic radiographer who isn't one of the nicest people, because the patients they work with, they are so compassionate and caring, and they're making sure they're looking after the patient, and not just the patient but their family as well, because whenever anyone goes through a condition such as cancer, it's not just the patient who's dealing with it, it's the whole family as well. So they are incredibly lovely and caring people, therapeutic radiographers. They can also specialize in loads of different areas as well, so they don't have to just stick with treatment. You can go into medical physics and look at developing new types of treatment. You can go into more software development or IT or management as well. So here are some of the skills required to be an allied health professional. Sorry, quick sip. So there is something called the 6 C's, which are the core values of the NHS, and these are the ones on screen. So caring, compassionate, competent, communicative, courageous, and committed. And these come under the term of value-based recruitment. So a number of universities, when they're looking at students' applications and in interviews, they'll be kind of comparing this against these 6 C's, because they want to make sure that any students that they are taking on to do any of these courses are going to be caring, are going to be compassionate towards their patient, understands the appreciation for the need to be competent at your job and have the correct knowledge and skills, and are staying up to date with the relevant treatments. And also really important that they have communication skills. I feel like there have been many people who feel like when they've come away from a treatment or a kind of consultation with a practitioner, sometimes think, wow, that wasn't that great. And the reason that could be is because they're not actually as communicative as they could be. So it's really important that you've got patients who are caring and they're able to communicate really effectively. So when it comes to advising students, especially when it's looking at writing their personal statements for UCAS applications, make sure that they have examples of how they embody these different kind of criteria in their everyday life. So courageous could be standing up to someone when they've had an issue or there's been a disagreement as a team, like in a team sport, and just thinking how they've been courageous, let's say maybe what they feel in a very appropriate and effective manner, and what the result of that was. So these are the skills and personalities required. There are 3 main routes to becoming an allied health professional, and the main is an undergraduate degree. This is the main routes, and with this it will be Students will have lectures and seminars as part of their course, but also as part of the course they'll have integrated placements. So they'll be going out as part of their course into the field that they're looking to work with, initially shadowing practitioners, but then towards the end of their degree being a lot more hands-on. And this generally means that the jump from practice and training at university degree level and actually working as a fully fledged practitioner isn't that big of a jump, and often students say there isn't really much difference other than the fact you don't have someone looking over your shoulder. There is also more and more degree apprenticeships becoming available. They're still very, very new and many are in development. Not all of the allied health professions have got a degree apprenticeship associated with them. What we generally advise is looking at this website at the bottom left, so the apprenticeship.gov.uk website, and this will have a full list of the different professions which are offering apprenticeships. One thing that we find whenever we speak to students are they don't fully understand the way that an apprenticeship works. They just think they can go to do a degree apprenticeship at uni by approaching university and going direct, but if you ever speak to them, it would be really useful to advise that they have to go to the employer first and have someone who's willing to pay for them before they can approach the university, because we find that's often an area which students don't quite fully understand. And finally, the other route into these professions is through a postgraduate degree. So this is the only route, as mentioned, for art, drama and music therapy. But for some professions, if you might have students who have already done an undergraduate degree and as mature students decide they want to retrain, this is something they can do, and they would be eligible for a second round of student finance if they wanted to do this as a second degree. Alternatively, there are other professions where you could do an accelerated option as well. So for example, Podiatry and Therapeutic Radiography do have degrees available where they're able to do it as a 2-year master's course rather than a full 3 years undergraduate course, which just means they get to hopefully graduate a little bit sooner and start earning money a little bit quicker as well. As mentioned at the beginning of the webinar, there are grants available now for these different areas. So these professions in purple and orange are all eligible for a £5,000 non-repayable grant every year that they are studying on this course. And this is all students from the UK are eligible to apply for this loan as long as they are studying in England. So any student, for example, who's from Northern Ireland but is choosing to study at an English university will still be eligible for this funding. Unfortunately, any student, for example, Northern Ireland who's looking to apply in Northern Ireland wouldn't be eligible for this funding, as the devolved governments or administrations kind of have more control over their funding from their NHSs. There's the professions which are in orange are also eligible for an additional £1,000. These are the key shortage areas which we're trying to increase the amount of promotion for. So as a little extra incentive, there's the additional £1,000 kind of boost to study for these professions. There's also the £1,000 childcare support. This is for anyone who might have childcare or caring responsibilities. And there's also an additional £1,000 strategic region grant, which we don't yet know the areas which are deemed strategic regions for recruitment. However, when these do become available, this information comes out, we will be posting it on our social media. So make sure that you follow us. I'll give you the links at the end so you can make sure that you're staying up to date with those. So as you can see, over 3 years, you can earn a very, very healthy amount of money just for studying one of these courses. So what can you do as a career advisor? So you're always welcome to revisit these webinar slides on our website. Hopefully by the end of next week, we'll be posting all of our recordings onto our website, which will be available for download, and we'll be letting everyone know who attended our course when these are available. So keep an eye on your emails, and we'll hopefully be able to let you know when these slides are available. We are going to have a number of other webinars coming up, focusing on different areas, so keep an eye out on our websites. There's a fantastic resource on the NHS website, which is Step Into the NHS. It's a quiz which basically matches students' interests and personality types to different professions in the NHS. This isn't exclusive to the allied health professions. It's across all 350 different jobs in the NHS, but it's a really, really useful tool to recommend to your students. And also you can then look a bit further into the government grants as well if you wanted to. Thank you very, very much for listening. I hope you found it really informative. I know this might not be the most thrilling thing to listen to on a Friday afternoon, but we really, really appreciate you taking the time. Feel free to look at our website if you want to find out any more information. We've got loads of resources which are going to be going up very soon. If there are any questions we've been unable to answer today, do feel free to send us an email at info@iseethedifference.co.uk. That is only one dot, not two dots after difference. And as mentioned, we are on social media, so Instagram, Facebook, and Twitter at iseethedifference. So at this point, I'll see if we have any questions from Rachel.
We haven't had anything submitted, George. So I wonder if anybody's that they want to ask, then now's your time.
Yep, so if you have any questions, feel free to send them on through. We'll give you a couple of minutes. If not, we will say thank you very much. Sometimes it can just be that when you've had someone talking to you for 45 minutes, you haven't got fully time to digest all the information. So as I said, if you do have any questions after you've kind of digested all of this information, you can always send us an email through.
Right. Okay, so we've had one come through, but I don't quite know that this is our within our scope. But it's, how do you train as a sonographer?
So that's one that I'm not entirely read up on. What I might recommend is if you look onto the NHS Health Careers website, they've got loads of information of all the different professions in the NHS, and they'll have a lot more information. Unfortunately, we're not clued up on all the different jobs within the NHS. We're just kind of more focused on these 15.
And that, there's no more questions. Yeah. Oh, there is one. One person said thank you.
Thank you.
So I think that's it, George.
Okay, well, thank you very much, everyone, for listening. I hope you found it informative, enjoyed it.
Hang on. Got one just come through. So if you train as an orthoptist, can you work towards becoming an optician?
No, so they are two different degrees. You could do a second degree as an optician. However, generally what you might find is with these two professions, there's a little bit of optometry in orthoptics, and there's a little bit of orthoptics in optometry, but they are two different degrees. So you would have to do, you'd have to essentially do a second degree again in optometry. However, unfortunately, I don't think you would be eligible for a second lot of student loan entitlement, so that would then probably have to be self-funded.
So we've just got some messages of thanks, but I think that's probably it now for the questions.
Great. Okay. Well, thank you very much, everyone, for listening. I hope you enjoyed it and found it informative. Yes, keep safe, keep well. Thank you very much. Bye bye.